Okay, welcome back. Next, we have Kenton Hummel of University of Nebraska, Lincoln. Noisy child care centers can negatively impact children and their caregivers, but studying the soundscape could help create the supportive, healthy environment that they need. Kenton's going to tell us a little bit about that, and I can't wait to hear more.
All right, thank you for that. Today I'm here to talk about improving child development by monitoring noisy daycares. Just in general, kind of why do we care about the daycare environment? In a general sense, children's early life experiences are strongly linked to lifelong outcomes. Those outcomes are health, academics, social well-being, and additionally, a large population of U.S. children from birth to age 5 are in some form of non-parental care. Some form of non-parental care can vary even just from daycares to a wide variety of different spaces used. And then we're not only just concerned about the children in daycares, but we're also concerned about the staff and the child care teachers. So one study found that child care teachers had significantly more voice disorders compared to hospital nurses. Those voice disorders could be nodules or laryngitis. And one thought of why this occurs is there's few opportunities to rest your voice, additionally coupled with high background noise levels. So the overall objective of this study is to just better understand early child care soundscapes. So soundscape research breaks it down into 3 different areas. So this would be understanding human perception, so the occupants in there, what are they perceiving the environment to be? Measuring the acoustic environment, so that's understanding both typical levels, and then here in this, also applying machine learning to try to understand what's going on in a different way. And then context, so how do those 2 things relate? How does the acoustic environment impact human perception? So for this study, for perception, a staff follow-up survey was implemented to measure the acoustic environment. 3 daycares were selected, 5 rooms in each daycare, so in total 15 daycare rooms of varying ages were measured for long-term noise measurements, which overall are relatively scarce out there. And then in context will be a little bit more of the future work of this. So diving right into the staff follow-up survey, 7 questions were asked here. Asking 11 participants how often do they experience the following in their main classroom. So these orange lines here indicate the grouping of if they responded sometimes to most of the time, and the blue lines are indicating if they rated it from never to rarely. So just highlighting a couple of these different points here. About 70% responded saying that they wish it was quieter in their main classroom. Additionally, if we look at some of the other ones here, sound disrupts children's rest is up there as well as sound feels overwhelming to them, sometimes the most of the time in their main classroom. So now looking at this plot here, so what this is showing us is sound pressure level across time. We're zooming in here on just 1 day of open hours as our overall, in one of the rooms of one of the daycares. So what we're looking at here is each one of these data points shows one of the minute measurements. And then what I did was used machine learning, so a clustering technique which allows us to separate our data out into 2 different groupings. And so we can start to think of these red dots since they had higher sound pressure levels, and not only equivalent sound pressure level, but also looking at our maximum and our peak sound pressure levels, so different metrics. We're able to start to think of these red dots maybe as an active time period, and then these black dots as a non-active time period. So what this allows us to do is analyze both what's going on during active times as well as non-active times. Additionally, we can maybe subtract out the mean of our active and our non-active, so we can kind of look at the difference between that to see the range of sound going on in the environment. And we can also think about the percent of time active, so how often was each one of these rooms being classified as active, going back to child care teachers not being able to rest their voice, maybe how often are they able to do that. So now we have machine learning helps allow us to do that with our acoustic measurements. So just kind of to summarize what we just talked about here, so the staff survey gave us a little bit of insight showing that sound can overwhelm staff, can also potentially increase difficulty with talking. Looking at the daycare acoustic environment, overall there was kind of found a high background noise level, so additionally if you look at that non-active time period as well as even during the closed hours, which I didn't show, you can see that there's potentially some higher background noise levels than recommended. Additionally, the active versus non-active, the machine learning techniques allow us to analyze in a different way, maybe giving us a little bit of an extra insight into what's going on in the daycare soundscape. And this is ongoing work, analyzing language data collected to try to then bring back together the context to understand how this acoustic environment is impacting the occupants. And with that, I want to thank you all so much and open up to questions.
Thank you, Kenton. Well, I'll start it off with a question. So is the idea that some of these results eventually could kind of help you design rooms and daycares or ways to keep sound levels kind of lower?
Yeah, absolutely. So with the insight of the non-active time period, that goes into designing the spaces to try to design maybe the mechanical systems and just the overall size and shape of the rooms to try to once we understand what's going on and what people prefer, we can then start designing better soundscapes.
Looks like we have a question from the room.
Have you given any thought to why your active and non-active areas are cyclic? In other words, it looks like as a function of time. Part of the time you're active, and then suddenly there's some kind of tipping point. So you have a little region that's non-active, then it goes back and forth throughout the day. What causes that?
Yeah, so that just depends on maybe like structured versus non-structured activities going on in the daycare. Maybe if they took a little bit of break, or maybe if there's a certain quieter assignment or something they were working on. So that just kind of comes to what the child care teachers are doing with the students.
But there's not really a tipping point either way?
I haven't noticed anything, no.
I had a question about the black and the red dots, either with inactive. Right at 6 o'clock p.m., it drops really low. Is that indicative of like everyone's gone and it's quiet hours? You can kind of compare that empty building to what the other inactive times are, like how quiet they get to the quietest. Is that an accurate interpretation?
So I think just at the end of that plot there, that's kind of showing, yeah, that people were leaving, and then so I cut it off by the open and closed hours. So there's still people in there. But it was probably during the closed hour, or it was about to be the closed hours, so less occupancy.
So I was curious, when you had like the really loud high peaks, do you know, is that just one really loud kid, or is that like the aggregation?
Good question. I'm not sure exactly. We just have the sound levels, so we're not sure exactly what is causing that.
Okay, great. Well, thank you, Kenton, and we'll be back in 1 minute with our last presentation. Awesome. Thank you. Good job.